If you ever felt like your digestion is just unpredictable, some days you feel fine, other days you're bloated, uncomfortable, reacting to foods that used to be fine. You've probably asked yourself, why does this keep happening? Because it's not just one bad meal, it's a pattern. In the next few minutes, I'm going to walk you through why digestive symptoms tend to come and go, and what may be driving that pattern underneath. And if you want to understand how we approach this in our practice, I'll show you exactly how we help patients start addressing this in a structured way. I'm Dr. Adam Zuckerman, founder of Fuel Functional Health, and I work with people dealing with chronic digestive issues, fatigue, and immune-related symptoms who are frustrated because their gut never seems to fully stabilize. And one of the biggest things we help people understand is this: your gut symptoms are not random, because most people think digestion should be consistent. If you eat the same foods, you should feel the same way, but that's not what happens. Instead, symptoms come and go, and that inconsistency makes it harder to figure out what's wrong. So what do? They start eliminating foods. They try different diets. They take probiotics or supplements, and sometimes things improve. But then the symptoms come right back again. Here's why that's not working. It's because the issue is often not just food, it's the environment inside your gut. And if that environment is disrupted, your response to food becomes inconsistent. So here's how we start looking at things differently in our practice. First, your gut has a protective barrier, sometimes referred to as the intestinal lining. Its job is to let nutrients in and keep unwanted things out. Second, when inflammation is present, that barrier can become more vulnerable. You may have heard the term leaky gut, and while that's a simplified way of saying it, it reflects a real pattern where the gut becomes more reactive and sensitive. Third, at the same time, your gut is closely connected to your immune system. So when that barrier is disrupted, your immune system becomes more activated, which can lead to increased sensitivity to foods, more inflammation, and recurring symptoms. Fourth, and this is why your symptoms don't stay consistent, because the underlying environment hasn't stabilized yet. So your gut keeps reacting instead of regulating. The reason this approach works is because we're not just trying to remove triggers, we're working to stabilize the environment inside the gut. And when that environment improves, digestion becomes more consistent, less reactive, and more predictable. If you want to understand how we approach this step by step, you can learn more using the link below. It walks you through how we help patients identify what's driving their symptoms and how we begin restoring balance so you could finally start seeing consistent improvement.